At least a dozen states have already reached that threshold of getting at least 70% of the adult population vaccinated with those COVID-19 doses. But with many U.S. states, especially in the South, lagging far behind, there are new concerns that there could be a summer surge in COVID cases. Let's bring in Dr. Stella Safo. She is New York City-based HIV primary care physician. Doctor, good to talk to you today. How real is that concern right now when you look overall about the vaccination rates, this potential for there to be another surge come this summer?
And I think it's a potential that we have to acknowledge, because COVID has shown us at every turn that, it's kind of like half a step ahead of us. We know with the variants that are coming out that, there are some changes that make even those who are vaccinated still able to pick up those mutated forms of COVID. And so the concern now isn't so much even the summer as it is the fall, when we get those respiratory illnesses that come up quite a bit. So that concern always for a surge is something that remains. And it's why we're always doing the genetic analysis to make sure that, the new strains that we're seeing, that our vaccines are still effective against them.
We also obviously have President Biden's goal of at least 70% of adults vaccinated by July 4th. That's kind of the next checkpoint here to track. And it seems like we're falling off when you look at how many people are getting vaccinated now, fewer than 1 million shots per day. You dig into that and look at it across the country. Western and Eastern coast states seem to be doing well, at least at or near that 70% threshold already. But when you look at the rest of the country, how realistic is it that we're going to hit what Joe Biden wanted to hit? And how problematic is it if we don't?
It's pretty problematic if we don't, in that if we have a population that is not vaccinated, COVID is able to spread very freely among that population. So the higher we get of our vaccinated population, the better all of us will do, because COVID isn't spreading and COVID isn't mutating. The challenge here is that the very folks who didn't believe COVID was real or didn't believe in masks and kind of all of the resistance that we saw are the folks who are not willing to get the vaccines. And so there's a question now of who are their trusted messengers? Who among kind of the folks that they look up to would they listen to and go and get the vaccine? Because we are finding that we are reaching the populations of folks who are willing to get the vaccine pretty well and getting to high numbers there. I will say, though, that there are still, minoritized populations that absolutely need additional help with access and making sure that we bring the vaccine to them, homebound individuals, unsheltered individuals. So there's work to be done still for folks who want the vaccine but may not have access. And yet there's a question of folks who haven't gotten vaccinated yet and have access who don't want it. It's not clear to me if they will ever want it, and if people like me and others saying it will actually help, or if they need to hear from their trusted messengers.
Doctor, the good news is that you've got about just over half of the country who has been fully vaccinated. But there seems to be a lot of questions about just how much longer the protection from those vaccines are likely to last, especially with talk of boosters come fall. How should we be thinking about that issue right now?
I think that issue is one of those ones that it's a question mark. Well, what we're seeing now is that it seems like the vaccines, the immunity is still good. And we have folks who've now been immune for a little over 6 months because the first doses of vaccines went out December 2020. And it seems like we're not seeing an uptick in individuals who've been vaccinated suddenly getting infected with COVID. And we're able to check also for how long that immunity is lasting. I know that a lot of our pharmaceutical partners would like us to kind of start right away getting ready for boosters, but the scientific community wants to make sure that would actually be needed before we start to recommend that, wide scale. So I think it's a real question. If we are seeing that immunity is waning, we definitely will be moving towards individuals getting the booster. But as of now, it seems like, especially if you've had COVID before and then you got vaccinated, your immunity is incredibly strong.
A lot of comfort for those who have been vaccinated so far. Dr. Stella Safo, New York City-based HIV primary care physician. Great to have you on today.